Hello, creators. The 2024 Creator Circle Retreat, happening September 23rd through 26th in Vancouver, Washington, United States, is filling up fast. The registration deadline is June 1st, and we just have a few spots left. Visit wellnesscentercreators.com/retreats for all the info and to apply for your spot, or email me directly at kendall@wellnesscentercreators.com. Can't wait to see you there. As health and wellness providers, we know that better patient outcomes require a whole person, multidisciplinary approach that we just can't provide on our own. That's why I've started the Wellness Center Creators podcast. I'll be bringing you interviews with experts, tips, tricks, secrets, resources, systems, and solutions so that you don't have to reinvent the wheel. And creating your wellness center won't feel like starting over. Before we jump into today's episode, let's give a shout out to our sponsor, Jane, a clinic management software and EMR. Whether you're just starting to do your research or you've been contemplating switching your software for a while now, the Jane team understands that the process can feel intimidating. That's why their goal is to provide you with all the onboarding resources you need to make the switch as smooth as possible. Jane offers a personalized call to set up your account, a free date import, and a variety of online resources to get you up and running quickly. And if you need a helping hand along the way, you'll have access to unlimited phone, email, and chat support included in your Jane subscription. If you're interested in learning more, book a one-on-one demo at jane.app/switch. And if you decide to make the switch, don't forget to use the code WELLNESS1MO at sign-up to receive a 1-month grace period on your new Jane account. Welcome back, everyone, to the Wellness Center Creators podcast. Today on the show, we have Anna Rudell joining us as co-host, and our wonderful guest today is Jennifer Cobb. Welcome to both of you today.
Thank you.
Yeah, thank you very much.
Jennifer, I'd love if we could start by just introducing yourself to our audience and sharing a bit about how you got to be doing what you're doing present day.
Yeah. So my name is Jennifer Cobb. I'm a licensed clinical social worker and private practice owner in Greensboro, North Carolina. So I started my practice. I was a solo practice for a year. I started in 2011, and through that year, kind of decided what I was specializing in, and really through, I think, a natural chain of events and my heart, listening to my heart and the community's needs, ended up specializing in dialectical behavior therapy. Spent that year by myself, was very lonely, and started bringing on other clinicians and grew into a group practice. We've got 25 folks right now and a pretty bustling practice.
Wow, that's a big team.
Yeah. Where I have to brag on us. We've got a really, really amazing group of clinicians.
Wonderful. I know Anna's very curious to learn more about DBT.
I am. I have no idea what those three words together mean, Jennifer.
Yeah. So dialectical behavior therapy. So it's a type of therapy modality, and it really combines kind of a mindfulness and acceptance practice within what's not working well in my life. And so it's a fabulous modality to be able to work with folks who are chronically suicidal or, lots of kind of impulsive behaviors. I think of it as a therapy that's for folks who had some really early developmental trauma, attachment wounds. And so helping people get to know themselves again and get to know how to be in relationship again.
So do the sessions with your clients differ from a more traditional approach?
Yeah. So when you say traditional, what my mind goes to is kind of like a talk therapy session.
Yes, yes.
Yeah. Yeah. And so DBT, the way that we practice it here is more of what I would call like a body-based modality. So we're really trying to help people get back into their body and listen to the cues that their body is giving them about, I don't feel safe, or I gotta jet, I gotta get out of here. So really kind of settling in and listening to our bodies. And from there, again, kind of redeveloping a relationship with what our body is telling us. So less talk and more kind of skills based and body based.
Oh, that sounds wonderful.
Yeah.
Yeah.
It really is such a beautiful modality and very compassionate, and it has a lot of room for, like you were saying, somatic practices within it, but also like expressive arts practices and creative things. And Anna, for you as an acupuncture clinic owner and acupuncturist, I think of, what would be a good referral, to a DBT therapist. And I think of patients who are coming in just a very acute state, and who have tried all these other things, and they just talk therapy hasn't worked for them. And that's kind of what I think of with DBT.
It sounds like often we would come out of a treatment room as acupuncturists and say, oh, we just need to bring them into their body. And it sounds like those would be the patients that would be good referrals for you.
Yeah, yeah, absolutely. One of the big things or goals that we try to do is calming our nervous system, right? When we've lived so long in fight or flight or appease or freeze, so we're really trying to get our nervous system calm down a little bit and again, kind of back re-regulating with folks around. So yes, absolutely, Anna, those, the folks that are like, whew, it back in the body.
Well, thank you for sharing. Now I am the wiser on that now. Thank you.
For asking.
Jen, you say that your group practice model is different. What do you mean by that? What is it different from, and how is it unique?
Yeah. So this is like, I'm getting goosebumps. This is one of my favorite things to talk about. We have a model that we really kind of co-created. I say we, and I'm talking about all the clinicians that are here. We started for the first couple of years as a 1099 practice, which means, right, our clinicians were not employees. They were kind of on their own, contracted with us to come in and do sessions, which is pretty common in our field. And then, it just started not feeling right for both myself as a practice owner and the clinicians. And we found that our clinicians were getting essentially kind of punished for having higher caseloads. And so we sat around the table and kind of came up with this. We were looking at co-op models of being able to have more of an employee-centric practice. And it just didn't, for several reasons, it just didn't make sense to do a co-op model. And so we developed our own model, which to me is like a marriage between a W-2 employee and a co-op practice. And we call it a collaborative community model. And it's I think it's a really unique way to be able to have a practice. The clinicians pay in what we call a membership fee per month, and then they take 100% home of the money that they bring in with their clients. And so we found it a really, really like win-win-win, right? For the practice, for myself as the practice owner, for the clinicians, and for our clients. The clinicians can really kind of set their own schedules and figure out, do I do better when I see 17 people a week or 30 people a week? And so there's a lot more stability and wellness on the clinician side, which of course translates into client care and wellness.
That's fascinating. So one might think of that as rent, but it's not rent, is it?
It's not, no. So there's, again, kind of that collaborative model. So there is, they are paying a portion of like expenses and space, but they're also paying for like what goes into that is, being able to have our community events and all of the stuff that's outside of rent. So website, all of that kind of stuff. And then the benefits that they're getting, right, are peer support, supervision. They don't do any marketing or networking. So it's kind of the best of the clinical world without having to do any of the administrative stuff. Yeah. So, and we call it our employee-centric model. So it's really, the wellness is really, really highlighted and focused on our clinicians so that, again, they can be well for their clients. And we see really, really great outcomes, both in longevity. I've got a couple clinicians that have been with us 9 or 10 years. So folks tend to get here and stay here. And so we're not, going through staff every couple of years, and which is really disruptive, of course, to client care. So really kind of see it as a community collaborative model and employee centric.
Well, it sounds beautiful.
Yeah.
And where my mind goes is to the business side of it, is like from a legal perspective, right? Because the listeners are listening going, well, how would I set that up?
Yeah.
How can I hire someone, but then require them to pay?
Mm-hmm.
So what were your steps in the background? Did you have to create like a managed service organization? What was the legality of it in your state?
Yeah. So in North Carolina, it is absolutely legal to be able to have like a commission-based practice.
Right.
And so our employee contract is set up, again, they're W-2 employees, so the taxes are coming out. And it's set up as it's based on commission, but instead of doing a percentage split, we're doing it's not a fee split, but they're paying in a fee. So as long as in North Carolina, as long as they're making above minimum wage, which they absolutely do, then it's, it dots all the I's and crosses all the T's to be able to legally be able to practice the way that we are. So we really you asked about the steps that we went through. We did a lot of consulting with practices in other states that had actual co-ops functioning. And then we figured out how can we, take what we love from that model and, within the guidelines of a W-2, be able to put that in. And so we are, officially tax-wise W-2 employees and function that way. But on the back end of it, then it's instead of a percentage split or a flat fee per service, then they're just paying in a part of what they have brought in for income.
What's the feedback that you've had from your employees about this model?
Yeah, that very, very positive. So we are actually in the process of writing a book because they are, I've had folks say that this is the first time that they felt that they were in a healthy work environment, that they could make their own decisions, that this was truly not a hierarchical system, and that they came in and were equal and, didn't have kind of that hierarchy to function within. We've had folks, like I said, 8, 9, 10 years that have been with us. So very, very positive feedback. And again, I think that, a phrase that we use a lot is that I'm not, or no one else is policing their money. So they get to kind of prioritize what's important for them. Is health insurance important for them? Is, a vacation a month important to them? So they get to kind of prioritize and police and make decisions for their own money.
But they're under the auspices of one practice.
Right.
So, okay. And then how do you manage that? I'm sorry, Kendall, I'm taking all the questions.
You go right ahead.
When you say manage that, can you be more specific?
Yes, because you have a crew of 25, which sounds like a lot of practitioners to me, and a lot of different time models or behavior ways that each practitioner might work. Mm-hmm. So there must be some support, and I'm curious as to what your staff, how you'd manage that.
Yeah. So within both within the model of functioning within DBT, but then also just based on our peer support model, we have an hour and a half of DBT consultation team every week. And so we're broken up into 3 groups, and we're consulting with each other regularly. And so folks are getting clinical support that way. In addition to, we've got some folks that are getting clinical supervision. And so we've got a pretty clear, when I talk to folks about building their own practices, we'll get on my soapbox about mission, vision, and values. And, that it's not just this one thing that you come up with and then, type it up on this pretty sheet and put it on in the bookshelf, but that you're actively using those mission, vision, and values to guide your decision making every day. And so we talk a lot about that as a team. And so we've got, we've kind of got a clear path about, are we all heading in the same direction? And to do that, we know, what those values and mission are. Mm. Anna, did that answer your question a little bit?
It did a little bit. I think I'm curious about the nuts and bolts of it, because to me that sounds like such a large team and so many variables, because it's such what would be the word? You said your practitioner, flexible and peer-led in many ways.
Mm-hmm. Yeah. So I think the beauty of it is that I don't feel any pressure at all to micromanage folks, right? So they come in, we do a fantastic training and onboarding process. And, again, there's kind of phases of, are folks getting supervised by someone here, or are they independently practicing? And so we do a pretty good kind of, here's the framework within what we practice, right? So, and then from there, they get to be their own professional adult, right? And so, if they've got questions, we're all pretty open and definitely supporting each other. But I don't, have any need, and nor do they want me to micromanage their schedule, or, I had someone, we've got a newer clinician, and we talk a lot about unlearning. We've all been in environments that, weren't so great, or most of us have anyway, in work environments. And so there's an unlearning process when you come here. Mm-hmm. And one of our newer clinicians texted me a couple days ago and said, I'm going to be out sick tomorrow. And I was like, thank you for letting me know, but you don't have to let me know. Do you need anything from me? So it's really just this, we trust each other, and we've done things to show that we deserve that trust. And, as adults, we just get to do our best within that. So I think there's a tightness in terms of the community, and there's a looseness in terms of accountability, in terms of micromanaging and, being able to decide what days you come in and what your ideal schedule is. And, I'm a morning person, so I'm here in the morning. I've got some folks that don't come in until after 11. Mm-hmm. It's all, that's all centered around their own taking care of themselves.
I get curious around, how much it's broken down for them of what they're paying in, and how, if you get pushback on, the things that they're paying for, right? So I have curiosity, and you don't have to answer this, or we can cut it out. But, are those fees that they're paying for, are they paying for all the support staff? Do you have support staff? Are they paying for your salary? Are they paying, what's the scope of, what that's covering?
Yeah. So I'll start like top level and answer that. And then if that's not deep enough, I have no shame. We can dig down as deep as we want to go. So the way that we have figured out the fee, and it's interesting because we've been doing this for probably 10 years at this point. And so I did not have 25 employees back then, right? So we started, and it was a group of, I think, 4 or 5 of us, maybe 6 of us. And interestingly, the formula that we used back then has translated and stayed the same up through current time. So what we did, and what we still do, is we sat down and figured out what are all the expenses of running this place, right? So That's support staff, that's supervision, that's insurance, that's our, electronic health record. So everything at all that it takes to have our doors open and functioning, we added all of that together and came up with a number. And then that number was divided by the number of clinicians that we've got. And so at that time, it was divided by 5 or 6. And then that amount is their monthly amount that they pay in. And they get paid every 2 weeks. And so they pay half on one paycheck and half on the other paycheck. Mm-hmm. And when we were functioning as 5 or 6 folks, and when we're functioning as 25 folks, that formula, that number, that membership fee has stayed the same. Because as we grow and need more support staff and need a bigger space and more rent, then we've had, more clinicians come in. So it's really stayed very, very stable. So they know exactly how much the dollar is. It's the same. So for the first 2 weeks of their paycheck, X dollar comes out of there, and the next 2 weeks of their paycheck, X dollar comes out of there. And it covers, like I said, absolutely everything. So right now, we're up to 3 support staff. And when we started, we had 1 support staff. And so it's really just, given the intentionality behind it and paying attention, right? So when we just moved into our space where we're at about 3 years ago. And so I knew what numbers we had to work with, and that I didn't want to raise anyone's membership fee. And so I was able to find a space that worked well with that.
What a creative model. I'm absolutely fascinated. And there seems to be so much freedom in it for the people that buy in. Yeah.
Yeah, there is. And again, it's a one set fee. So if you decide you want to see 5 clients a week, or if you want to see 25 clients a week, the fee is the same. And so again, it helps folks really be able to not have like minimum caseload numbers, right? So I've heard from a lot of folks, I've got to meet 25 client hours a week, and we don't need to do that because I think that is counter to our own wellness, right? If I'm having a week where I am just not doing well, then I need to be able to balance that. And so did that answer?
Absolutely. Yeah. Okay. I appreciate you sharing the details. Yeah. I think our listeners, they're all business owners and trying to figure out the best way for themselves and their group and their teams to make it work and to thrive in the way that they want to. So I think it's important, and I appreciate your candid explanation of the model.
Yeah.
So it sounds like you host retreats for practice owners. Is that correct? And you have one coming up. Do you want to tell us about it?
I sure will. Yeah. So 2011, I opened my practice, and then probably 7 years ago, started mentoring and coaching and consulting other folks that were getting ready to launch into their own private practices. And so coaching both private practice owners and group practice owners. And then if they want to learn more about this collaborative community model and sit down and kind of run the numbers and figure out how that would or wouldn't work for them, we do that. If they're like, nope, that's not the model for me, then that's perfectly fine too. So really just kind of focusing on what are their values and how do they want their business to look. So one of the ways we do that is by having intimate therapist retreats, right? So our soonest retreat coming up is in October 15th through the 19th. It's at the Outer Banks in North Carolina. And it's our Dream It, Build It, Live It retreat. And so this is really focused around those newer practice owners. So folks that are either have just recently within the last couple of years opened their own private practice, or will be in the next couple of years opening their own private practice. So really geared towards those solo owners. And one of you mentioned a couple minutes ago about nuts and bolts, and that's what I think of this retreat as. It's really the nuts and bolts of what numbers do I need? Who do I need to have, contact with? How do I, decide if I take insurance or not insurance? So it's really kind of a nuts and bolts retreat that is like combo working, getting consulting, and then also some vacation. So we've got a hot tub and we're right on the beach.
And is that just psychotherapists, or is it open to other modalities?
Yeah, so we've had other small business owners join us. So I had a nurse practitioner ask about, and so I think anyone, it's definitely, my background is in therapy and opening a business that way. So I'm going to be coming from that perspective, but I think a lot of it translates into other small business service providers.
Sounds like a wonderful resource. Jen, if people want to connect with you, how can they do that?
Yeah, so they can, email is a good way to connect with me. So Jennifer at Creating Community, and Creating Community, I just have to say it out loud. It is spelled CreateEing. So Jennifer at creatingcommunity.com. And then we've got a Facebook page, Creating Community. We've got a website, dbttherapist.kartra.com/page/creating community. I don't know why that's
all of it will be in the show notes, so people can just click on it as well.
Beautiful.
Jen, it's just been a pleasure chatting with you and hearing about your model. And I think this has been really valuable for our audience. Thank you so much.
Absolutely. I appreciate being here and having this opportunity. Thank you both.
Thank you.
Thanks so much for listening to the Wellness Center Creators Podcast. I hope you enjoyed the episode. Please visit our website at wellnesscentercreators.com for more show notes and additional episodes. By the way, I love hearing from listeners. Please send me an email at Kendall, KENDALL, at wellnesscentercreators.com with your feedback. And if you send me a question, maybe I'll read it on the show, anonymously, of course. Thanks so much again for listening, and we'll catch you next time on the Wellness Center Creators Podcast.